Hello and welcome to day 6. Today we're just going to talk about some basic radiology terms. So you're going to hear these words when you start to look up the radiology codes. So you have the radiograph, and that's an image produced using x-rays. Contrast media, you'll hear a lot about that when coding. It's a substance used to enhance imaging visibility. A fluoroscopy is a real-time moving X-ray image, and then a projection is a direction or angle of the imaging beam. So, the projection is when it projects out, that's the image that you see. These are different types of imaging that are used. So CT, which is computed tomography, those are cross-sectional images that use X-rays. MRI, magnetic resonance imaging, uses magnetic fields and radio waves. So this is how they view. Ultrasound also is known as a sonography. It uses sound waves to create images. And nuclear medicine uses radioactive tracers to evaluate body functions. You'll often hear nuclear medicine associated more with cancer treatment with chemotherapy and radiation treatment. Positioning and directional terms, you'll hear about these when you start looking up codes or when you start hearing about radiology and x-rays. So you have AP, and that's how they'll refer to it. If a physician would say, hey, go take an AP x-ray, it's called anterior-posterior. It's an imaging beam travels from front to back. Okay, so it starts at the front and goes to the back. Posterior, postero-anterior, is the imaging beam travels from back to front. Lateral is imaging from the side of the body, and oblique is at an angled position. Radiology terminology helps to support accurate documentation and coding. It helps to identify the correct CPT and ICD-10 codes, and it also helps to improve communication between providers, coders, and radiology staff.